Welcome to the explainer. Okay, think about this for a second. A medicine cabinet just overflowing with pills. Now, every single one was prescribed to help, but when you put them all together, they can create this silent threat. That's the reality of polypharmacy. And today, we're going to look at how healthcare teams on the front lines are solving this incredibly complex puzzle, all based on a training program from Dr. Mohammed El-Naji Mohammed. It's a really tough question, isn't it? How can the very thing that's supposed to heal us actually end up causing harm? We put so much trust in our medicines. But, as we get older and our bodies change, just the sheer number of prescriptions can create a hidden danger. So let's explore how these expert teams are tackling this exact problem head-on. So, what is polypharmacy really? It's more than just a complicated word. It's when someone is taking a bunch of different medications, and that can lead to this tangled web of risks. Things like bad side effects, dangerous interactions between drugs, or honestly, just getting confused and not taking them right. We're going to untangle that web and show you how a whole healthcare team makes sense of it all. So, where does the team even start? Well, before you can fix a problem, you have to see it clearly, right? This first step is all about detective work. It's called medication reconciliation. Now, this is way more than just a quick glance at a prescription bottle. Think of it like trying to balance a checkbook for someone's health. The team has to build one single, accurate list by comparing what the patient thinks they're taking with the records from their doctor, their pharmacy, maybe a recent hospital stay. And you know what the most important part is? They check what's actually in the medicine cabinet at home. You would be amazed how often those lists just do not match up. All right, once that master list is finally put together and checked, the physician steps in, and they start a process that might sound, well, a little counterintuitive. It's called deprescribing. The whole goal isn't to add more medicine, but to thoughtfully and, most importantly, safely take some away. And this is not random at all. It's a very systematic four-step approach. First, you've got that master list. Then, the doctor reviews every single drug on it. Is this still needed? Is it working? Is it safe? After that, they pinpoint which pills can be safely stopped, usually starting with the riskiest ones. And finally, and this is absolutely crucial, clear communication. Everybody on the team, and of course the patient, has to be on the exact same page, because just one missed change can unravel the entire safety plan. So let's talk about the usual suspects. These are the kinds of drugs that pretty much always get a second look. We're talking about things like benzodiazepines, sedatives that can make people drowsy and cause falls, or those older first-generation antihistamines that can lead to confusion. For older adults especially, whose bodies might process these medications a lot differently, the risks can really start to outweigh the benefits. That makes them prime candidates for deprescribing. Okay, now let's shift gears to the nurse's role, because this is where a critical layer of safety gets built in. The doctor makes the plan, right? But it's the nurse who's there with the patient, often in their own home, making sure that plan is carried out safely. The nurse really is that immediate safety net. They're constantly checking that the medication record actually matches the doctor's new plan. And if anything at all seems off, a confusing dose, a missing instruction, they don't guess. They stop. They withhold the medication and they escalate it. They're also the team's eyes and ears, constantly watching for side effects and, so importantly, teaching the patient about why their medicines have changed. And this is what they're looking for. It isn't always something super dramatic or life-threatening. Sometimes the clues are really subtle, a little more confusion than usual, maybe a stumble, or even just a dry mouth. These are exactly the kinds of things that can get brushed off as just, oh, that's part of getting older. But for a skilled nurse, these are vital clues, valuable data points that could signal a problem with a medication. But managing someone's health isn't just about what's in the pill bottle. This team approach brings in other experts, like a physiotherapist, who can look at how a medication affects a person's physical abilities and offer some powerful, drug-free alternatives. So this slide lays out two very different paths. On one side, you have medicines like sedatives and strong painkillers that can make someone more likely to fall. But on the other side, you've got a physiotherapist offering a solution that doesn't involve a pill. For something like chronic pain, a tailored exercise program could be so effective that it actually reduces or even gets rid of the need for those high-risk drugs. It's really about empowering patients to manage their health, not just medicate symptoms. The whole system is designed to be super careful and methodical. But what happens when someone on the team spots a serious, immediate threat to a patient's safety? Well, that's when these escalation triggers come into play. These are the absolute red flags. A sudden, severe reaction, like a huge drop in blood pressure or sudden confusion. That means everything stops.
If a nurse isn't 100% sure how to give a high-risk drug, they escalate. And if that initial detective work finds two different doctors prescribing similar drugs for the same problem, which happens more often than you think, that triggers an immediate halt to prevent a potential overdose.
And all of these actions are backed by solid evidence. This isn't just one clinic's good idea. It's a strategy that's recommended by major health organizations, like the World Health Organization. These two core principles, painstakingly reconciling that med list and thoughtfully deprescribing, are really the global gold standard for keeping patients safe. So, what's the big takeaway here? I mean, solving the puzzle of polypharmacy is really like conducting an orchestra. You need the doctor's skill, the nurse's watchful eye, the physiotherapist's expertise in movement, and of course, the patient has to be an active participant. When they all work together in harmony, the result is a much safer and much healthier patient. So, knowing how all this works can really empower you to take more control of your own health or to help a loved one do the same. And I'll leave you with this final thought. At your next doctor's visit, what if the most powerful question you could ask isn't, "What new medication do I need?" but instead, "Is there anything I can safely stop taking?"